Hey, this is Swag. Thank you for stopping by. I'm bringing an update on a story that just broke in Philadelphia today, which is January 8th, 2024. The Philadelphia Department of Health is tracking a measles outbreak in the city with 8 confirmed cases as of today. Health officials are stating that these cases are primarily among non-immune individuals. The health department said it's actively tracking current cases and has listed several known exposure sites across the city. Measles is one of the most contagious infectious diseases and can easily be spread from one case to dozens of others in a contained area. So, after speaking with Dr. Indy Trahan, who is a pediatric infectious disease specialist at the University of Washington, Seattle Children's Hospital, the Center for Disease Control and Prevention stated that the measles virus particles can remain infectious for up to 2 hours once they are airborne. After an initial flu like illness, patients with measles can develop ear infections, severe diarrhea, superimposed pneumonia, or a brain infection and swelling. It's considered a surface disease, which means that all of the major exposed surfaces of your body get broken down, like your respiratory tract, your gastrointestinal tract, and your eyes, according to Dr. Trahan. Please keep an eye on your loved ones, your children, and especially those who have a compromised immunity, and seek medical attention if you notice any of these symptoms.
Meantime, the measles outbreak in Philadelphia, it is growing.
The Philadelphia Health Department says there are now 5 confirmed and 3 probable cases, while adding that there could be more. Health reporter Stephanie Stahl joins us now with an update from the health commissioner.
Lots of moving parts with this case, you guys. Dr. Bedegal tells me this is a serious outbreak that has 3 children still hospitalized. Now, it started because the quarantine order was violated, she says.
This is a major event.
The Philadelphia Health Commissioner says there are now 5 confirmed cases of measles and 3 probable. She says the 8 cases started with a baby too young to be vaccinated who traveled internationally. That child was hospitalized at Children's Hospital of Philadelphia in December. And before the measles was diagnosed, the virus spread at CHOP to children in adjacent rooms.
Early measles before the rash can look like any other respiratory infection.
Dr. Bedegal says one of the 3 children with measles at CHOP was released from the hospital, then taken to this daycare center while still infectious, violating quarantine orders from the health department. At that daycare center, how many more infections do we have now?
So we have 2 confirmed infections and 3 probable infections at that daycare center.
A sign at the Multicultural Education Station daycare in Oxford Circle reads in part, several children have shown symptoms. No one at the daycare would answer our questions.
Both the daycare and the parent had been asked to observe quarantine orders, did not share that information.
The health department says the measles outbreak is among both people who are not vaccinated and babies under the age of 1 who are too young to be vaccinated.
People don't necessarily understand just how serious an infection this is. So the fact that Philadelphia is seeing 8 cases, we could see more before this is over, really very, very concerning for us.
Now, the MMR vaccine covers measles, mumps, and rubella. It is available at doctors' offices and drugstores. And for people who do not have insurance, there are government programs that cover the cost. Now, with this measles cluster that's still being investigated, the health department says there are more potential exposures. We have those locations for you at cbsphiladelphia.com.